It's Dr. John with TheHealthyMD, and I'm back today to talk about constipation and the ketogenic or low-carb diets. Now, this is something that I get patients that bring up to me every so often. When they start a keto diet, they come on in or they give a call and say, hey, doc, I tried it and I just too constipated, too bloated, just really uncomfortable. I had to stop the diet. Didn't work for me. Well, I'm here to tell you a couple things you can do to help prevent that constipation and why that constipation may occur in the first place, and how to set yourself up for success if you're going to start the ketogenic diet and avoid that constipation or some of those other bowel issues that may happen. So let's talk about constipation. What is it? It's really decreased transit time of food as it goes through the small and large intestine and comes out the other end. And with that decrease in transit time, typically more water gets absorbed out of it. So out of the food as it turns into stool or it gets processed, it gets digested, less and less water in there. Stool becomes firmer, becomes harder, and has decreased or increased transit time. So it takes longer to get from point A to point B. So from the mouth into the anus. And that's really why people have that constipation. And it can be several different reasons for it. As far as from a ketogenic diet standpoint, usually it's because of some change in the gut bacteria and change in food choices as you're starting that ketogenic low-carb diet. But for other people, if you're a diabetic or if they have some other underlying medical problems, or certain medications can also play in to constipation. So it's really important that you talk to your doctor before you start one of these diets if you're on medications or if you have some underlying health issues such as diabetes, and try to figure out if there's going to be an issue with that constipation and what do you need to do to prevent that. One of the things we do see on a ketogenic diet is a change in the gut biome or the gut bacteria. And that's important because that will have an impact on transit time, or how quickly or how slowly your food moves through your bowels, and whether or not you end up being constipated or having normal bowel movements, or in some cases, actually transit times increase or decrease quite substantially, and people get diarrhea with it as well too. So what's going on? It really, in the most part, comes down to types of fiber, or how much fiber or how little fiber you're taking in your diet under a ketogenic low-carb diet. Now, there's two types of fiber out there. Soluble, which is absorbed into the water and kind of pulls water back into the gut, and insoluble fiber, which actually acts more as a bulking agent and kind of acts more of an irritant and a laxative in the bowel. And both of them are important as far as, I think you need a combination of both soluble and insoluble fiber in your diet. So when a lot of people go keto, first thing they do is they cut out all types of vegetables. And one of the things you need to do is make sure you're getting at least a good mix of soluble fiber, vegetables, and fruit in your diet that don't spike your glucose levels and don't spike your insulin levels and knock you out of ketosis. And there's a bunch of different foods that you can take on a ketogenic diet that have that soluble fiber in there. Psyllium husks have a good combination of soluble and insoluble fiber, mostly soluble fiber. Psyllium husks are really what medications like Metamucil have in them. So you can use just a scoop of either psyllium husk or Metamucil in the morning with a glass of water, and that should help as far as enough soluble fiber to help prevent any constipation. Now, the other issue that may be happening is that there's that change in the gut biome in your diet. And that may also play into how quickly stool or how quickly you digest your food. And if there's a significant change, and what's interesting is that there's a couple studies out there that show on ketogenic diet, it's not an all or nothing, but there's kind of this gradual decrease and an increase in different type of gut bacteria as you go through the ketogenic diet. And there's also a change in the production of short-chain fatty acids as well too. So things like butyrate, which are also important as far as with weight loss, may change on a ketogenic diet. The other issue that we see as far as adding the constipation on a ketogenic diet is some people are dehydrated. So one of the things that happens initially when people start a ketogenic diet is they diurese, which means they get rid of extra water. You're losing some of that glucose. For each gram of glucose, you have about 4 grams of water. So as your glucose levels or glycogen levels in your muscle and liver go down, you have to get rid of that water. And people don't keep up on on their water intake, or they're not getting enough electrolytes as well too with their water. So they end up peeing out or getting rid of a lot of the water and not actually using that water as far as bulking up in their stool. So making sure you stay well hydrated on the ketogenic diet, especially if you're starting off, is going to help as far as making sure that you're not constipated. Now, what are the types of foods that you can eat or should be eating to make sure you have enough soluble fiber? So we already talked about psyllium husk, and really any type of nuts are going to have a combination of soluble fiber and insoluble fiber. Fruits, so berries, are probably going to be a really good source. Kind of the unripe bananas, although with bananas you got to be careful, because if they're too ripe, then they're going to have a high sugar content. That'll kick you out of ketosis. A lot of green leafy vegetables, so we're talking about just your regular lettuce, arugula, kale, things like that, Swiss chard, all going to have a fair amount of soluble fiber that'll help as far as preventing or improving any constipation you have. Other fruits, like my grandfather always used to have prunes and prune juice to keep himself regular. Again, soluble fiber in the prunes. And again, would recommend more of the whole fruit rather than the juice, because if you've ever done any juicing and you use one of those big juicer machines, what you get left behind is all that soluble and insoluble fiber, and then you drink the fiber-free juice that's high in sugar, that raises your glucose levels and raises your insulin levels, and will kick you out of ketosis. Other green vegetables, so we talk about like asparagus, things like that, leeks, also going to have a fair amount of soluble fiber that's going to be helpful as far as maintaining your gut biome and helping you with that, keep your bowels regular. So those are kind of the important things as far as kind of preventing constipation on a low-carb ketogenic diet. Make sure you plan ahead, make sure that you do have enough soluble fiber built into your diet, especially in the first couple weeks that you're starting off with a ketogenic diet. You don't want to dive right in on just like a straight carnivore diet. I know some people do that, but I think that there's some issues as far as some people are really sensitive to that change in their gut biome if they're not getting enough fiber. So I usually tell patients, start off, low carb, transition over to keto, and if you want to keep going, then try something more like carnivore, or something that's, don't want to call it extreme, but it's kind of to the other end as far as a typical American diet. See how you do with it, but also be able to admit if you need to backtrack and add more fiber into your diet, because again, that fiber is really important for keeping the probiotics, for keeping your gut biome healthy. And if you don't have healthy gut biome, if you don't have the right mix of the gut biome, you're going to run into issues, whether it's going to be constipation, whether it's going to be irritable bowel. You're going to notice issues with that. So again, I'm Dr. John with TheHealthyMD. Here's some tips to help you prevent having some constipation on a low-carb ketogenic diet. Hope this is helpful. Please leave a comment down below if it was. If there's other topics you want to hear me cover, then let me know. And most of all, make sure you hit the like button and the subscribe button.